Hey, welcome back to our next podcast with the Benefit Builders. Myself, Brian Gleiss,
Matt Spate.
and we're joined remotely by,
Mark Blassie.
hey, Mark. Today, our topic is Medicare and group health insurance. Mark, I'm going to pitch it directly to you. Tell us what you see out there as it comes to our Pillars of Excellence, the tool that we use to make your benefit program as efficient as possible.
Brian, as you know, and our regular listeners are beginning to appreciate, we use a tool called the Pillars of Excellence. And one of those pillars is the cost of investing in employee benefit programs, particularly group health insurance. One of the most overlooked tactics to help reduce the cost of your group health insurance is active employees who become Medicare eligible. We encourage and highly recommend to our clients that at a minimum, once a year during open enrollment, the entire population is educated on the topic of Medicare. And when you reach that age, to go visit with a Medicare expert to help determine whether you can be getting better coverage sometimes, but more affordable coverage most times by going down the Medicare path.
No, absolutely perfect. And here at the Benefit Builders headquarters, what we're doing is we're drilling down. And so me and Matt know that if you have an individual that's eligible for Medicare, which normally means they're at least 65 years of age, not always, but normally means they're at least 65 years of age, we know that the employer, when we look at that price on their tally, is paying in the area of $1,000 a month for that particular individual. Now, your employees cannot be forced to go on Medicare. I repeat, they cannot be forced to go on Medicare. That's not the way it works. But when you have someone like me or Matt that can sit down with that employee, compare and contrast the benefits that are available by Medicare to your group health plan, we're going to look at things like deductibles. We're going to look at things like maximum out of pockets. We're going to look at things like monthly cost. Not all the time, but I would say a large percentage of the time that employee says, yes, it would be better for me to go on Medicare. Now, Matt, you've had experience with this inside of our own agency. Would you mind sharing how we came to the realization to say, hey, this is a better deal, and as a matter of fact, we will help you pay for it?
Yeah, Brian and I have gone through this type of process with anywhere from small groups to large groups. The first one we did was our local agency here, our insurance agency that we have here. And it just came about that the cost of our growing, aging census here at the agency was going astronomical for those older employees. And we wanted to look into Medicare. And like Brian said, we're saving thousands of dollars a month because we have 5 or 6 or 7 employees that we've moved from our group over to Medicare. And that not only gives them better coverage and saves us money, but sometimes it moves a couple of those sicker employees off the group, and then it brings the group cost down, and then it helps out all the rest of the employees as well.
Yeah, creating that win-win-win situation, So what we do as your benefit builders, when you look at the Pillars of Excellence, the base of that pillar is the foundation is concierge service. So you will have employees that no matter what you do, they think that you're trying to trick them off of the group health policy. Well, we want to show them face to face how a switch to Medicare would work. And there's even been times where I've been meeting with an employee of an employer, and as I'm meeting with them, they tell me that, oh, well, my wife is disabled and she's currently on disability. And we drill down and we say, has she been on disability more than 24 months? The answer is yes, she qualifies for Medicare, and we go down that path. So whether it's for the employee or the dependents, the biggest deal is we just want it to make sense. And I think that's what sets us apart, guys, is that we're on a podcast right now because we're trying to get the word out, but we're not preachy individuals. We're not product pushers. We want to come in and we want to make things efficient, and we want them to make sense. And with the three of us, especially Mark Blassie being the architect, he boils down those reports. He looks at the trends. He sees what other options are available. So the three of us as your benefit builders, we want you to feel comfortable. We want you to feel that we are an extension of your team. This may be the shortest podcast we've ever done, but even though it's the shortest podcast, do not overlook it as potentially one of the most important, because the devil's in the details, and I say those a lot, and this is one of the details that we can help you with. We've done personally. Mark, anything to say in closing?
I think you underscored the do not overlook it, but I would like to emphasize that you have to make sure you're aware of the compliance, that there's some mandates out there that you need to pay attention to. So encourage you, make sure you're working with advisors like the benefit builders when this topic is explored.
Sounds good.
Yeah, Mark mentioned compliance. One of the key things is who's going to pay the premium for the employee going to Medicare. Typically, in our experience, that has been the group, because we're saving money. But we need you to confirm that with your CPA on how they want you to do that. We can assist you with that process, but we need your CPA or your accountant or your tax person to help you through that. As Brian said, both Brian and I specialize in group health insurance. We also specialize in Medicare. So you put those two things together, we can certainly help you through this process. If you're a large employer and you might have 20 employees over the age of 65, let us help you. Let us do some sort of group presentation with your employees and walk them through that process.
Because one of the things we've said in almost every podcast is the benefit builders wants to help you attract and retain top talent. And in certain cases, that's individuals that may qualify for Medicare. So the idea is not to work them out of your group. The idea is to support your group and support them at the same time to our fullest potential. So that's what we do, guys. Benefit Builders helps you get your employee benefits as efficient as possible, and sits down and talk to your employees whenever they need us. So that's it. Give us a few moments of your time. Share this podcast if you know of somebody that you think may benefit from it. We appreciate it so much. Bye, guys.
Bye.
Thank you.